Hello, everyone, and welcome. Thank you so much for joining me. And today we're going to be talking about an exciting topic called Why Do I Have Painful Sex? So let's talk about sex, and not the fun kind, unfortunately, it's the painful kind. So you're experiencing pain before, during, or after sex. So let's discuss the reasons why this might be happening and what I would suggest actually doing about it. So I hope that all of you on Instagram have a better view of me today. I've got this pro set up. I've got the phone on top of a tissue box. So if you go crashing down, that might be due to that. So apologies in advance, but it's better than looking up my nose for the whole of the stream. So I'm so thrilled to be here today, and for those of you that don't know me, my name is Michelle Cooke. I'm a hormone and fertility naturopath. I'm a natural fertility educator. I'm a naturopathic practitioner, emotional release practitioner as well. And I'm the founder and director of Reproductive Wellness, a clinic located in Melbourne in Australia, and I see patients online and face-to-face. So if you have any questions or comments as we're going through the live today, be sure to pop them in the comments down below. If you're enjoying the content as well, I would really appreciate any likes or loves as we go through as well to show to me that you're enjoying it and that I'm not alone staring at a screen. Okay, so let's dive into it and talk about painful sex today. Now, it's quite a juicy topic. When I was looking into it, I realized, wow, this is really hectic. Like, there's so many different reasons why it can occur. So yeah, let's get started and get into it. So painful sex, the technical name for it is dyspareunia, okay? So it's pain that can take place before, during, or after sex. And it can impact women of all ages, and it's important to remember that it's not normal, ladies, and it means that your body is subtly or not so subtly telling you that something is actually not quite right in the body. So it needs to be addressed, that's for sure. And having painful sex, of course, this can lead to low libido, being afraid of being intimate with your partner, loss of interest in sex because it hurts, right? Like, why would you feel like doing it if you're worried and anxious about it being painful? You can have a fear of sex. There can be emotional issues related to it as well. So guilt, shame, anxiety, stress, and relationship issues as well, of course, as a result of that. So there's two main different types of dyspareunia or painful sex. There's superficial dyspareunia. So this can be pain that occurs when the penis enters the vagina. So around the entrance of the vagina, or the vulva is the exterior part of the vagina there. And it can be due to so many different things. So let's cover that today. So it can be due to hormonal issues. So if there's low estrogen there, that's when it leads to vulvovaginal atrophy, or a thinning of the vulval tissue, or the actual uterine, the vaginal lining, okay? And that can be due to a number of different reasons. So that can occur during menopause, because as estrogen levels start to drop, that's when the vaginal lining becomes more thin, and the vulval tissue as well, so the external part of the vagina becomes more thin as well. Also perimenopause potentially, because that's basically the journey or the prequel to menopause. So on the way there, estrogen levels start to drop as well. So potentially it could occur during that time frame as well. Birth control, so there are certain types of birth control that can actually affect natural production of your own estrogen, and that can lead to pain with sex as well. Breastfeeding is another one too. So we need to remember that estrogen is actually responsible for a thick, stretchy and strong vaginal wall, okay? And it assists with healthy blood flow to the vagina as well, and the uterine wall. There's certain secretions that it helps with to make it nice, rich, juicy and plump, okay? So low estrogen leads to issues with the tissue there being less stretchy, more thin and less lubricated or less moist. Apologies to the people that don't like hearing the word moist. You'll probably hear that several times throughout the live today, but it's just one of those things that we'll be discussing today. Now, vaginal dryness, that can be another reason for painful sex as well, of course, and that can be due to lack of sexual arousal. So there could be psychological reasons there. You could have had uncomfortable previous sexual experiences, anxiety, stress, previous sexual trauma or emotional trauma or abuse that can lead to a lack of sexual arousal. Sjogren's syndrome is another one. Oral contraceptives, we need to remember that they stop ovulation from happening, and they also stop the natural production of your own estrogen. So that leads to vaginal dryness, ladies. Another one is menopause as well. So I've discussed that before, because there's a drop in estrogen. It's actually really important. Estrogen is important for moisturizing the tissues and hydrating the tissues of the vagina. So very important role estrogen has to play. Other issues could be skin issues, so things like lichen planus, lichen sclerosis, dermatitis, immunobolus diseases as well. Other issues could be nervous system disorders or damage to the nervous system. So things like neuroma, which is a thickening of the nerve tissue, spinal nerve injury or compression, pedunal neuralgia, sorry about the pronunciation. Sometimes I just can't wrap my head around the technical names there. And herpes neuralgia is another one. Vaginal infections, so this is quite a big one. So things like genital herpes, Trichomonas vaginalis, Candida albicans, and bacterial vaginosis can all contribute to having painful sex. Emotional causes, so as I've previously discussed, there could be sexual or emotional abuse. There could be a previous traumatic situation that's happened to you that's affected your sex life as well. Sexual arousal disorders, so things like the absence or decrease in the initiation of sex, sexual thoughts, pleasure, interest in having sex, desirable response, lack of arousal either emotionally or physically. Abnormal tissue, so neoplasms, so things like squamous cell carcinoma and Paget disease as an example. Other things could be illness due to medical treatment or examination. So you might have had some sort of procedure that has ended up where you've ended up with painful sex as a result. So pelvic radiation, chemotherapy, or post-operatively for some sort of pelvic reason. Anatomical issues, so things like a narrow vaginal entrance. Clitoral adhesions as well is another one. Vaginismus, so you might have heard of this one. So recurrent or persistent involuntary spasms of the muscles of the vagina, which impacts the ability to have sex. So that can be rather painful. Vulvodynia is another one. So there's pain and sensitivity when pressure or touch is applied to the actual vulva, and the nerves in the area are rather sensitive, so that causes pain as well. An intact or thick hymen, so you know when you're a virgin, for example, the hymen increases because normally the hymen sort of partially covers the vaginal entrance, but once you have sex, that kind of moves a little bit wider, so that can be an issue as well. There could have been trauma to the area, so genital mutilation, vaginal delivery from birth, or an episiotomy, so the procedure where they actually create incisions on either side of the vagina to prevent, further or more full-on tearing there. And that can lead to sort of scar tissue, and the nerve endings are more sensitive there, so that can lead to pain with sex as well. Now another one is Bartholinitis. So there's a pair of glands either side of the vagina, and these normally produce moisture when you're aroused, okay, when you're sexually aroused. So Bartholinitis, oh my gosh, just the terminology, just to wrap your head around it, is the inflammation of those glands, okay? So pain will either be straight away when you're having sex, or as the sex continues on, it will be more painful because there's no moisture there and lubrication that's provided by those glands. So that makes sense, doesn't it? Because they're inflamed. There could be size issues, so the penis is actually too large for your vaginal opening. So there's lots that can be done there in terms of seeing a sex therapist that can help you with positioning and different ideas to help you with that scenario as well. Now, the other type of painful sex is deep Dyspareunia. So that pain occurs when the penis is actually deeper into the vagina, and the pain could resemble things like tearing, burning, aching, dull or sharp type of pain. And it can occur in the genital organs themselves, or it may be due to the penis actually bumping other organs located close to the uterus in that pelvic cavity area. So it's kind of like bumper cars, but not the fun kind. So it's kind of knocking those organs and causing pain as a result of that. So this deep type of sexual pain can be caused due to, again, trauma to the area. So genital mutilation, vaginal delivery from birth, or the episiotomy process as well. Vaginal infections, so things like genital herpes, Trichomonas vaginalis, Candida albicans, bacterial vaginosis. Vaginal dryness again, so lack of sexual arousal due to psychological reasons, Sjogren's syndrome, oral contraceptives as we discussed, and menopause. It could also be due to hormonal reasons, so low estrogen states where there's vulvovaginal atrophy, so thinning of the vulva, so the exterior part of the vagina, and the vaginal walls themselves. So as I discussed, things like menopause, potentially perimenopause, birth control, and breastfeeding. Pelvic inflammatory disease. Now this is quite a big one, and this is due to sexually transmitted infections. So things like chlamydia and gonorrhea. And this condition actually affects the uterus, the fallopian tubes, and potentially the ovaries. So there's a lot of pain and inflammation associated with that. Now, bladder or urinary tract infections could be another reason too, because if your bladder is inflamed and it's due to an infection, that can be painful during sex because it's closely located, it's a close neighbor to the uterus, so the penis can potentially bump that and cause further inflammation. Another issue could be bowel problems, so perhaps you suffer with ulcerative colitis, Crohn's disease, irritable bowel syndromes, for example. And if those organs, or the bowels, which is in close proximity to the uterus again, if that gets knocked during sex, that can cause pain as well, because that's another fellow neighbor of your uterus. Now, positioning of your uterus as well can actually affect it too. So if your uterus is retroverted or retroflexed, so it's in kind of a tipped position towards the back of the spine, that can actually cause pain with sex as well. Fibroids, so they're non-cancerous growths that are in the muscular wall of the uterus. Ovarian cysts, so they can be knocked during sex as well. Endometriosis, so the uterine lining, tissue like the uterine lining is growing somewhere elsewhere other than the uterus, and there's a lot of pain and inflammation already associated with that. And there can particularly be more pain if there's actually adhesions or scar tissue actually joining particular organs together, and then the penis is actually sort of knocking and bumping those areas as well. Adenomyosis, so that's the uterine lining tissue actually growing inside the muscular wall of the uterus. And any type of pelvic disease as well would affect it potentially too. So what should you do about it? So that's a really good question, and it kind of depends why it's actually happening for you. As you can see, there's a myriad of reasons why it could be occurring. So it's important to actually investigate exactly why it's happening for you so that a treatment can be determined. So what I would suggest for diagnosis and for treatment is to actually see a GP and potentially get a referral to a gynecologist so that they can investigate further for you. For supportive treatment, so if you find out the reason why you've got the painful sex and you want additional support, I would recommend making an appointment with a hormone and fertility naturopath like myself to support you. Emotional support, that's extremely important. So seeing someone like a sex therapist, like I mentioned before, because they can help you with, if it's due to certain positioning, or if it's kind of fear or anxiety around sex, sort of getting you feeling more comfortable with sex, that would be a good option to explore. A couples counsellor might be a great idea too, a psychologist, or a naturopathic emotional release practitioner. So I'll speak more about that. That's actually a technique that I use for emotional support. If required, a pelvic physiotherapist is a great idea as well, because it might actually be due to pelvic floor issues. So that can help with the symptoms that you're experiencing as well. So as I discussed, the treatment of Perineuria will be different depending on why you're actually experiencing it. And regardless of the cause of the painful sex, so this is really important, I would always suggest seeking out emotional support, because there'll always be an underlying emotion or stress related to why it's actually happening for you. And just generally speaking, the fact that you're unable to have sex or you're having difficulty having sex with your partner, that brings up a lot of emotions as well, which need to be dealt with too. Something that may have started as a physical issue, for example, can potentially lead to emotional issues, of course, because it impacts your emotional well-being and how you feel about yourself and your self-worth and things like that, and also your relationship with your partner as well. And it can bring up emotions such as, shame, guilt, fear of failure, depression, anxiety, stress, a fear that you won't be able to have sex. And all of those things need to be worked through on an emotional level. It's absolutely key. So, and even after the issue has been dealt with on a physical level, there can still be sort of emotional issues that are still hanging around. And that's because you have an anxiety or fear that pain will happen again when you have sex. So you really need to deal with the emotional and mental side of it as well. So you're probably wondering, well, can a naturopath actually help with painful sex? And the answer is absolutely. So especially a naturopath that specializes in hormones and fertility, which is what I do. In my clinic, I use things like herbal medicine, nutritional medicine, diet and lifestyle advice. I also look at your pathology results as well, quite differently to a GP. So you'll have the broad range on the pathology test, but I'm always making sure that you're within that optimal range, which is really important because things can go wobbly in between the range, and we want to address it before it becomes an issue later on. So we look at that, we make sure that your hormones are in range as well, because as we discussed, if there's a drop in estrogen or if it's too low, that can contribute to painful sex as well. So we need to look at that. Also, if you've got low testosterone, that can lead to libido issues, and that can sort of compound as well to painful sex issues too. So we can address things like stress, anxiety, any fear that you have around sex, any previous traumas that you have related to it, hormone imbalance, skin support if it's if there's an issue with your skin that's affecting your sex and your ability to have sex, we address that. If you have any STI infections, so sexually transmitted infections, we can actually help support that with herbal medicine as well, and help in conjunction with the medical treatment that you're receiving. So if that's something that you'd like to explore, I would absolutely love to help you, and I would encourage you to actually book a free 15-minute discovery call with me. So basically, if you're watching on Instagram, the link is in my bio, so you can click through there. If you're watching on Facebook or YouTube, I'll actually pop the link down below for you. Does anyone have any questions while I'm still on at the moment? I'm just going to check Facebook as well, just in case. Okay, and if you're too shy and you do want to ask me something, just make sure that you send me a PM or a DM, and I'm absolutely more than happy to answer that for you or clarify anything regarding painful sex. And I would like to thank you so very much for watching me this evening. It's been an absolute pleasure. If you're watching on my YouTube channel, be sure to like and subscribe. And just so you know as well, all of these videos that I do every week are actually on my blog, on my website. So if you're the kind of person that would prefer to read through it all, I've actually got the video up top, and then underneath I have it all written. Because sometimes I'm a bit of a visual learner as well, and I prefer to see it written. So if you go to reproductivewellness.com.au/blog, you'll see all the videos there and all the juicy information that you can go through. And yeah, so basically, don't forget, I'm on every Wednesday, 7:30 p.m. Australian Eastern Standard Time. So I'll see you next week, and we'll talk about something hormone and or fertility related. Thank you so much for joining me. Have a great evening. Bye.